Good evening to all the viewers who are watching live and will be watching on the recorded version. Sorry for this much delay. We were facing some network issues, after which, after a long try, we finally crossed the network issues. And again, let me tell you, the this e-participation certificate link is live. You can just go in the description below and just click over there, and you can get your e-participation certificate. All you have to do is just few simple things, and then you will just get it. So with this, we have wasted too much time, and without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, sir.
Good evening.
And good evening to all our viewers. We are on the 104th episode of Continued Medical Education. And on that, to be with the time and to go with the time, we had brought up a very pertinent topic, a burning topic, which is a must for all the homeopathic all the homeopathic practitioners across the country. And today's topic is legal responsibilities of a homeo physician, the guidelines of NCH. And with your permission, our beloved President Kalyani, sir, let us call on the inaugurator tonight. Kalyani, sir?
Sure. Please call him.
The inaugurator tonight is an alumni of NIH, and he has been with the West Bengal Police Service, which is one of his dream, and he is now Deputy Superintendent of Police of Cooch Behar district, the most active, dynamic, and loved for alumnus of NIH, and also a beloved person of the people of North Bengal, Dr. Chandan Das. I'll request Orko to bring on Dr. Chandan Das on screen. Good evening, Dr. Chandan.
Good evening, Chandan.
Good evening, sir.
Very glad to see you. Very
Thank you, sir. Good evening, distinguished guests, esteemed homeopathic doctors. As we gather today, I am honored to address the legal responsibilities of homeopathic physicians as per the guidelines of the National Commission of Homeopathy and the scope of other relevant laws in force. Actually, the National Commission for Homeopathy Act 2020 replaced the Homeopathy Central Council Act 1973. So, the National Commission for Homeopathy Act 2022, according to Section 55/1, read with Section 31/2, National Commission for Homeopathy Act 2020, they made some guidelines and the regulation. So now we are going to discuss the National Commission for Homeopathy Professional Conduct, Etiquette and Code of Ethics Regulator 2022. So in case of our daily practice, there are some legal boundaries. Although the National Commission of Homeopathy the regulations 2022 in their website, they have cited everything in very elaborate manner. I want to just discuss some of these topics. Today, along with us, there is a distinguished speakers, Mithun he is there. But just I want to highlight some of the points. Number one is character of the medical practitioner. It is clearly written that the primary object of a medical profession is to render service to humanity with full respect for the dignity of human being. Financial reward is a secondary consideration. Secondly, the standard of character and morals, and it is told that the medical profession expects from its members the highest level of character and morals. And every practitioner of homeopathy owes to the profession and to the public alike a duty to attain such level. Number 3, the practitioner's responsibility. A practitioner of homeopathy shall merit the confidence of the patient entrusted to his care, rendering to each full measure of service and devotion. According to the prescription and medical certificate, it is clearly written in that regulation, a practitioner of homeopathy shall provide the certificate or the prescription immediately, but not more than 72 hours. And for future, to combat any type of hazards or problem, professional hazard or problem, I would request to everybody to keep a record of every certificate in digital form or in hard copy. Yes, another important point is the negligent. So a homeopath can choose a patient to whom he can treat, or if he wishes to treat, or he may not treat him, but it is his own choice. But in case of emergency, he has to attend. According to the 106 of Bharatiya Nyaya Samhita 2023, previously, according to 304A of IPC, in case of medical negligence, there was the provision of punishment was larger or gravity was more. But in case of the Bharatiya Nyaya Samhita 2023, which has been enacted from the 1st July 2024, it is clearly said that whoever causes death of any person by doing any rash or negligent act not amounting to culpable homicide shall be punished with imprisonment of either description for a term which may extend to 5 years. But in case of physicians, any type of physicians, if such act is done by a registered medical practitioner while performing medical procedure, he shall be punished with imprisonment of either description for a term which may extend to only 2 years and shall also liable to fine. So in case of professional hazards, the ultimate thing may happen that a patient may die in the course of the treatment, and the patient party may complain to nearest police station about the negligence of the doctor. Don't be panicked. Just keep all in records in hard copy and soft copy, and documentation is very necessary, and the punishment is very loss. But according to the rule, his acts of commission or omission shall not be judged by any non-homeopathic standards of professional service accepted from him, but by those standards as are expected from the homeopath of his training, standing, and experience. That means a medical board by a medical college or any modern medical college or modern medicine, some MBBS doctor will form a board, and they will give the opinion that whether there is medical negligence or not, it is not guided or by the principle of our National Commission for Homeopathy rule. It is said that clearly the board will not be formed by non-homeopathic standards. It will be judged by the distinguished doctors of the same pathy. That means homeopath doctors will form the board, and they will judge the whether there is medical negligence or not. It was the more important. Another thing I would like to discuss here, that is the additionally other relevant laws in force that impact our practice, including the Indian Medicine Central Council Act, the Drugs and Cosmetics Act, the Consumer Protection Act, and the Clinical Establishment Act. These laws govern aspects such as licensing and registration, drug manufacturing, patient rights and consumer protection, clinical standards, and quality assurance. As homeopathic doctors, it is our duty to understand and adhere to these laws and guidelines, ensuring that our patients is not only effective but also legally sound. Let us embrace these responsibilities with dedication and integrity, upholding the high standards of our noble profession. Together, we can make a positive impact on the lives of our patients and contribution to the growth and recognition of homeopathy as a respected system of medicine. Thank you. Thank you.
Now over to Pritha ma'am to just bring up the speaker on screen. Thank you, sir.
Good evening, everyone. Respected Kalyani sir, Bidyut da, Pralay da, Dr. Chandan das. It's a very, very enlightening session which we are going to hear from Dr. Mithun Chakraborty. As Dr. Chandan das has briefed about the legalities and the responsibilities, we will hear more about it as it is related to the Board of Ethics and Registrations for Homeopathy under National Commission for Homeopathy. And as Dr. Mithun Chakraborty, he is right now the registrar for the Medical Council West Bengal. So I'll request him to come up and make the presentation, make us understand the legalities, responsibilities of the homeopathic physicians. And the viewers, I would request you that if you have any queries, you can put them in the chat box. And I welcome Dr. Mithun to come forward and make the presentation. Thank you.
Thank you, Didi. First of all, I would like to thank the authorities of NCH Alumni Association, Dr. Kalyani sir, Dr. Bidyut Mukherjee, he is my senior, and Dr. Pralay Sharma, and for selecting me as the speaker for the online CME 104. I think it is a 104th CME. Today's topic, already it has been discussed, legal responsibilities of a homeopathic physician, the guidelines of NCH. First of all, I would like to thank Dr. Chandan Das, DSP headquarter, Cooch, Behar. I was in Cooch, Behar. My first posting was in Cooch, Behar, Shital Kuchi. I had a talk with Chandan that he was also in Shital Kuchi for few years for giving a elaborate information and beautiful inauguration of this today's CME. And then thanks to Dr. Pritha Mehra, Research Officer Homeopathy Scientist 3 CCRH, for sharing informations and her view regarding today's CME. Before entering in today's topic, I would first like to enlighten all the doctors who are hearing me today regarding an important topic which we are facing, or which we are recently involved by the NCH and all the state medical council for homeopathy are really they are working on this matter, is the digitalization program of the registration certificate. And this digitalization program is being done throughout the India via the State Medical Council for Homeopathy, and our council is also taking an active part in this digital process. And this digital process is via Ayush Grid portal of National Commission for Homeopathy. First of all, you should know that what is this Ayush Grid portal and how to get entry. It is a very simple thing. We are providing all the council. There's no, don't be a confusion. You go to your individual council where you have taken your registration, from where you are being registered doctor. You contact that council and they will give you details of that. In short, I am giving a view of that. First of all, you will go to your state medical council and you will first update your details. Actually, many doctors, they don't go regularly to their council and they don't update their details. Suppose if you want to change, there is a change in the name or title of a candidate. So they keep it as they don't, they change it in the Aadhaar card, they change it in the voter card, but they don't change it in the registration certificate. And that creates a problem, because in this digitalization program, we need to update everything. Even your education qualification should be updated. I've seen many persons who are MD, who have done MD, but they are not entering their MD in the records of their council from where they have given the registration certificate. And so it is a very important thing that you should update these details. You should update the address. Many people have changed the address or they have shifted to one place to another place, but they are not, they are keeping that old address in their registration certificate. So first of all, it is your duty. Please go and visit your council of your state and you make necessary correction according to their instruction. According to them, you fill up the form and you make an entry in the record books of your council. Number one. Number two, when you will enter the Ayush Grid portal, they will give you a form. Here, all are registered doctors, as I know, that these registered doctors will go to the council and they will have the format. In the digital platform, it is given. You can even access it from your own computer, or you can go to the cyber cafe for filling up the forms. The important things that are needed for filling up the forms, you have to, the instructions are given in the form, in the beginning of the form, and one by one you will fill up the form. But 4 things are very important. Number one, you should have a photograph with you. You have to give the scanned photograph in the form. You have to upload it in the form, and then you have to give the doctor registration certificate, and it should be updated one. Okay, and Aadhaar card front view and back view, because some people give only the front view. It creates problem because the address is not given in the front side. If you give the whole of the Aadhaar card, it will be okay because the address is given in the front side. But somebody who are cutting that Aadhaar card, they should give also the back side also, because the address is given in the back side. And another thing is the university pass certificate. Here I should clarify what is the meaning of university pass certificate, because many people in our state, I have seen that somebody have passed DMS, BHMS, graded BHMS, BHMS, MD. So they are actually NCH. They want the starting education qualification, the first education qualification you have achieved. Suppose you are a TMS doctor, so you will upload the pass certificate of DMS. After that, you have done many degree, it's okay, but you have to upload the, suppose I am a BHMS, I will upload the BHMS certificate. No need of uploading the MD pass certificate. Is it clear? So the only thing, if you are in a confusion, you should go and visit your nearest council. Even our council, West Bengal Homeopathic Council, we have also given the video in Bengali for easy access of filling up the form. Okay, so visit your council for the NRH existing practitioner form. Okay, and it is the digitalization process which we are doing throughout the India in every council. Even the recently we are also trying to give the digital registration certificate to newcomers, means those who are passing out we are also trying. Instructions are coming from the NCH that we should also give the digital certificate. We should start giving, because all the colleges have been given the instructions that they are having the full instruction of digitalization process, and council will also very soon we will start throughout the India. I think Haryana has done already, but other council are in the process. We will also try to give the digital certificate for the newcomers. Let us start today's topic. First slide, please. Okay. Today's topic, as already discussed, let us shift to the next slide. National Commission for Homeopathy Act 2022. Whatever I will speak today, I will discuss today with you, are all given in the National Commission for Homeopathy Act 2020. And after that, in the year 2022, National Commission for Homeopathy Professional Conduct, Etiquette and Code of Ethics for Practitioners of Homeopathy Regulation 2020-22. Notification is being given. You can note it down, and it is being published on 13/12/2022. So if you have sufficient time, you can refer this notification and you will get the details of everything which we are discussing today. Next slide. What is prescription? Regarding prescription, I must say a practitioner of homeopathy shall provide the prescription to a patient. What just now Dr. Chandan Das told, that you shall provide the prescription to the patient within 72 hours as requested or required by such person. So this has been the trend. This is a wrong trend among many doctors, that they don't provide, especially homeopathy doctors. We have seen that in the rural areas, that they don't provide, even urban areas also. We do not provide prescription, and it is very illegal if you can land up in various type of medical legal problems in your practice life. Next slide. Registration number. A practitioner of homeopathy shall display the registration number in his or her clinic on every prescription as per medical certificate, or he and she shall display as suffix to his or her name over recognized degree, diploma, membership, honor. This is very important. Most of the doctors nowadays, we are observing that they are putting their registration number in their prescription pad, and it is a it's a advancement we are seeing. But all the doctors should make it a habit of putting their registration number in their clinic and also in their prescription pad, because it is also, later on I will discuss, many type of ethical problems will arise out of that, and misconducts will, various type of complaints. We are receiving various type of complaints. Recently I received a complaint that why the doctor is not putting the registration number in his prescription. So any time in your practice life you may land up in trouble. Next. Regarding fees, this is a very frequently asked question. Some of the doctors also ask various type of questions regarding the fees. Our National Commission for Homeopathy clearly says that fees for the professional service. Fees for the professional service, a practitioner of homeopathy engaged in the practice may receive the payment for such service. Yes, you are entitled for fees. Yes, and shall specifically intimate the patient at the time the medical service is rendered. Whenever the patient is coming and he or she is asking you, or you are giving him the treatment, and they ask you, what is your fees, doctor? You should speak clearly. There is no hesitation. You can speak clearly. There is nothing illegal in that. You can speak, but later on I'm mentioning two other points. Second point is fees is reducible at the discretion of the practitioner of homeopathy. This we all know, because some poor people, whenever they come, they ask us or they request us to reduce the amount of fees. We do so. But the third point, that I have heard this third point many times, but after reading it, it is some of the doctors, they very speak in this manner, that it shall be unethical to enter into a contract of no cure, no payment. This is very important. You should not utter this type of words to your patient, because it is totally unethical. Okay, let us go to the next slide. Duties of homeopathic practitioner to their patient in case of emergency. A practitioner of homeopathy shall be free to choose whom he or she will treat. He, provided he or she shall respond to any request for his or her assistance in an emergency. This we all know. Provided that he or she may refuse treatment. A doctor can refuse treatment due to the limitation of his or her expertise. You can refer the patient, and then later on they have seen that they have told that, and refer the patient to another appropriate physician or health facility in the interest of the patient. But if the patient says, if your patient requests you to attend for the emergency condition, you should attend. You cannot refuse that patient, but you can tell or refuse the patient for treatment due to the limitation of your expertise, or you are not expertise on that matter, so you can refer to another physician or another health facility for the benefit of the patient. Next slide. Now, let us discuss regarding the act of negligence. A practitioner of homeopathy shall use any drug prepared according to the homeopathic principle and according to the pharmacopoeial standards, which is approved by licensing authorities, and adopt other necessary measures, including modern investigation techniques, that is radiological, pathological, and others, are required for diagnosis and follow-up of treatment. If it is not followed, then it will be considered as an act of negligence. So it is a very usual thing that we should follow the homeopathy principle and the pharmacopoeial standards. But recently, 4 to 5 months before, I received one case where I found that the doctor was practicing after completion of his internship and getting the registration. The doctor was practicing in a nursing home, and I received the prescription from where the complaint has a patient party has complained against that doctor, that why this homeopathy doctor is using allopathy drugs in the nursing home. He is not an allopathy doctor, he is an homeopathy doctor. Why he is using? So this type of problem you may face. So it is my request to my all doctor friends who are just passing out from their after getting registration, don't involve in these type of acts, because nobody will save you, and it is considered an act of negligence. Knowing this very well, that you should not do this type of, you should not involve yourself in this type of activities, but many times we are facing these type of problems. The complaints are being repeatedly lodged regarding this type of activities. Next slide. Duties of homeopathic practitioner in case of serious manifestations and serious illness. Here, National Commission for Homeopathy clearly defines that the practitioner of homeopathy shall give timely notice to the family or authorized attendants of the patient and also to the patient when necessary. In case of serious illness, especially in doubtful or difficult conditions, the practitioner of homeopathy shall encourage consultation of experts. Here, I must say something that we all know the diagnosis and prognosis of a disease. So it is better that whenever you are feeling that the condition is getting worse or the prognosis is getting, you are understanding the prognosis of the case, so you should inform prior. So at least a time, the patient party should get time. So this type of thing is very important. You should be aware of that and you should inform the patient in proper time. Otherwise, the patient may complain against you and you may land up in many type of problems, medical legal problems. Next slide. Consent to medical treatment. This is very important. Many times, most of the students who are passing, they ask this type of question to us, and sometimes we don't give them proper guideline. But NCH is very clear regarding this. No consent of patient or relative or guardian is required for consultant or indoor patient department treatment or for diagnostic procedure, and in case of emergency condition, consent of the patient or guardian shall be obtained. And if a practitioner of homeopathy does not do so, he shall be liable to be he shall be liable to be punished in accordance with the provision of the Act. So, for normal consultation and indoor patient, for most of the diagnostic procedure, we don't need any consent of the patient or their relative or guardians. But if in case of an emergency situation, yes, you must take the consent, provided, later on, the sentence is very important, provided that the treatment for dealing with emergency situations where there is no time and the patient life is at stake may be given without obtaining prior consent, and the consent shall be deemed to be implied. Here I would like to mention one case. When I was residential medical officer in Midnapur Homeopathy Medical College and Hospital, one day in the emergency, our interns came with a patient from street. He was feeling very sick, and after when they entered with that patient, and the patient was in a very bad condition, and it was at the evening time, and no doctors were available except me, and interns were there. So at that time, we immediately put the patient in a stable condition and we gave the medicine. We made him whatever we can do with the patient and we can help the patient, we have done. And then after that, when he got his consciousness, he was confused, and he was not able to tell his address, or he was not able to tell any phone number, contact number. Whether he was alone or not, and there was a bag in his hand, that no documents were available. We are not able to get the phone numbers. So where we can, in this condition, it is very critical condition. We are not able to find out from where he is coming. So what happened? At first, we made that patient stable, we gave the medicine, and we gave him complete treatment. And then we called our local police station, that was Kotpally police station, and then they came, and then they asked the patient detail gradually, and the patient was able to speak after 2 to 3 hours. The patient was gradually able to give the proper address, and then they found their exact address, and they carried the patient to his residence. So this is very important. This last line is very important. provided that the treatment for dealing with emergency situation where there is no time and the patient life is at stake may be given without obtaining prior consent. Here, prior consent is not needed and the consent shall be deemed to be implied. This is very important. Okay, next slide. This is a topic which is very frequently asked. Many people, they think that telemedicine is illegal. Telemedicine, they think that whether we can go for telemedicine or not. Many doctors even, they ask. Those who are in service in central and state government, they know it very well that telemedicine is being approved by National Commission for Homeopathy, and throughout the India it has been done. After COVID situation, it is very popular. But many doctors who are practicing and in the private practice, they don't know, and they sometimes ask that whether it is legal or not, because they hear from somebody that telemedicine is going on in state and central, so they don't have an idea. So they frequently come to our council and they ask whether telemedicine is legal or not. So it should be very clear that NCH is telling that the consultation through telemedicine by the registered practitioner of homeopathy shall be permissible in accordance with the telemedicine practice guideline issued from time to time by the central or state government. Okay, next slide. Right to prepare and dispense. A practitioner of homeopathy has full right, has a right to prepare and dispense his own prescription. Dr. Hahnemann has also told in Organon repeatedly, which shall be done as per the need and according to the principle of homeopathy at the most hygienic way. Here also, I must say, some patient party also come. They ask many times that the doctor is preparing the medicine and dispensing from his own chamber, whether he is giving steroids or not, or whether the patient party creates doubt regarding the doctor. But if it is according to the principle of homeopathy, there is nothing to fear. There is no need to fear, because NCH regulation clearly mentions that a practitioner of homeopathy has full right to prepare and dispense medicine. No need to have confusion regarding this. Next, very important topic, medical and fitness certificates. A practitioner of homeopathy shall issue medical and fitness certificate to the patient when so desired. He or she will keep a copy of medical and fitness certificate as a record for at least 3 years. What Dr. Chandan was speaking regarding this, that you should keep a record, because in case of court, if you are being summoned from court, you have to show this document, and it will be an important document from your safety also. And the format of the medical and fitness certificate shall be as per the format at the appendix 3A and B of the regulation. Here I would like to show you that in the regulation it is clearly mentioned how to write. Some of the students, after passing internship or during internship, they ask, sir, how to write the medical certificate? Please give me a pro forma. Yes, our National Commission for Homeopathy, they have clearly mentioned how to write medical certificate and fitness certificate. See, whether it is visible or not, you can refer to our regulation, which I have mentioned previously, that in the regulation, in the page number 19, it is clearly written that how to write the medical certificate, the pro forma is given, and how to write the fitness certificate, the pro forma is beautifully given. You can use this pro forma, and they have made according to the standards. They have maintained the standards of how to write it. Okay. Next, let us discuss now the professional or ethical misconducts. There are many points put here in the NCH guideline, they have given in the regulation, they have given various type of professional and ethical misconduct, but I have selected few ones. You can go through the NCH guideline. They have given a number of near about, they have given misconducts near about 20 to 25. They have given guideline, but I have selected few ones which are very important. We face daily this type of problems, huh? And then we should be alert regarding this type of wrong conducts. So first, a practitioner of homeopathy shall be liable for disciplinary action if he or she practices any other system of medicine other than homeopathy. This is very important. Provided that nothing contained in this clause shall prevent or restrict to practice by medical practitioner of homeopathy under National Health Program and other program run by central and state governments after undergone any training or course recognized or prescribed by the competent authority. So a person who is a practitioner of homeopathy should practice only homeopathy. But sometimes in the national health programs and other programs which are run by central and state governments, where they are given training, there you should take the training, and you should understand the prescription is not, they are not telling that you should prescribe it. Here it is clearly mentioned that other than other system of medicine, you cannot practice other system of medicine other than homeopathy. But the knowledge you can attain or the guideline given in the National Health Program, you can follow that guideline. Okay, next. A practitioner of homeopathy shall be liable for disciplinary action if he or she issues any certificate referred to in Appendix 2 of the regulation which is found false, untrue, misleading, or improper. His name or her name shall be removed from the register of homeopathic practitioner, both from state and national register. What is written in Appendix 2? These are the list of certificates. I think it is visible or not. You can refer to the NCH guideline 2022. There it is, in this regulation, there are 10 certificates mentioned here that a doctor can issue. But any falsification or fraudery or anything which is not true or misleading, if the doctor is involved in these activities, he is liable for disciplinary action and punishments. Next slide. Number 3, a practitioner of homeopathy shall be liable for disciplinary action if he or she fails to display the registration number accorded to him or her by the Commission or State Medical Council for Homeopathy in his or her clinic. Already I have discussed this topic. So you should display it in your clinic and in your prescriptions. Number 4, the practitioner of homeopathy shall be liable for disciplinary action if he or she fails to maintain the records of the prescription and certificates issued by him or her. So for legal purpose, you should maintain the records of the prescription and certificates. Anytime you may land up in problem. So these prescriptions and certificates will save you from any legal matter. So be very sure. Most of the doctors I have seen, this is a very casual approach. They give the prescription, they don't keep the counterpart of the prescription, or they issues the certificate. These 10 certificates which have been mentioned here, all the doctors they give this type of certificates and they don't keep the counterpart. This is very wrong. You should keep the counterpart because it is for your future. Because anytime when the problem will come, you don't know. So you should be alert regarding that. Okay, next slide. Another professional or ethical misconduct is that a practitioner of homeopathy shall be liable for disciplinary action if he or she issues certificate of experience in homeopathy to unqualified or non-medical persons. Then further it is written, provided that nothing contained in this clause shall prevent or restrict the proper training and instruction of legitimate employee of doctors, midwives, dispensers, attendants, or skilled mechanical and technical assistants under the personal supervision of practitioner of homeopathy. This is very important because we all know who are from homeopathy fraternity that the pharmacy course is not at all available throughout the India except in West Bengal. In West Bengal, we are running the certificate course for 1 year. In Delhi, it is they are running the diploma. Delhi Council, Delhi government is running the diploma course in pharmacy, and I think Uttarakhand and Kerala is having these courses. But throughout the India, the pharmacy course is not at all available, and this has been a trend that even I have heard from the drug councils where they issue the drug license. They also tell that that you bring one certificate from an experienced doctor where you have worked for 10 years, we will issue you this license or this license. And many times in many times many years before, when people used to get the government service also by this, they used to, there was no course and the pharmacist requirement was there. So they used to issue the certificate. Doctors used to issue the certificates in lieu of money also. This is very, very illegal. Without any training or without having any qualification, people used to give this. So doctors should be very much alert that you should not give experience certificate or issue any certificate of experience in homeopathy to unqualified and non-medical person. This is very, very serious issue because many times we hear that this type of things is still going on, because many throughout the India that the pharmacy course are not available. They give certificate that this person have been in my chamber, he used to dispense medicine, he has got the sufficient experience for 10 years and I'm issuing him the certificate. So these are very illegal thing. So you should stop. No practitioner should land up in this type of problems because later on you will face many medical legal problems regarding this. So it is better, please avoid this type of things. Next slide. A practitioner of homeopathy shall be liable for disciplinary action if he or she uses touts or agents for procuring patient. When I was in Cooch Behar, in the Cooch Behar town, we used to see that rickshaw walas, the rickshaw pullers were being used. Even in Kolkata also, we have heard that rickshaw pullers, or the auto pullers, they are being entitled by the doctors, and they tell that please bring patient to me and I will pay you something in lieu of that. So these type of things, that the rickshaw pullers, they take the patient, and in Cooch Behar, I've seen that people who come from Assam border or Assam areas, and they used to take the patient to the Cooch Behar town, and they used to take money from the doctor side also and patient side also. This type of activities we have heard and we have seen. So this is very, very illegal. In case of allopathy doctors, I have seen in Cooch Behar. So this is very, very illegal thing. In other districts also, in other states also, this may happen, but this should not be. This is not a correct thing. If you are caught, you will be punished. Number 7, a practitioner of homeopathy shall be liable for disciplinary action if he or she claims to be a specialist without possessing a special qualification listed by the Commission in the branch concerned. This is very sad. Most of the time, whenever we are walking through a street, we find many nameplates of the doctors displayed that I am specialist in gynecology, I am specialist in pediatrics, I am specialist in rheumatic problems, I am specialist in tumors. These are very wrong thing. So we should restrict this type of things. We should not display this type of things because it is a purely a professional and ethical misconduct, and this type of activities will be problematic for you. So this type of activities should not be there, because we are receiving many cases almost every day. People are sending us mail that this doctor is writing this and that in their signboard, whether it is true, whether it is recently from NCH I got letter that a doctor wrote that he is a rural gyno practitioner. What does it mean? And they have asked me find out his registration number. He is not a registered doctor, but he is right. He has written to the President of India and to the Prime Minister also that he should be given privilege because he is practicing rural gyno in gynecology in rural area of, I think, in Nadia district most probably, and this type of claims he is making. So this type of illegal things, this should not be these are not being entertained by in the eyes of law. Next slide. Manner of taking disciplinary action and the procedure of receiving complaint. Actually, this is an important matter which is for us, for the Board of Ethics and Registration for Homeopathy and for the respective state council. But for your knowledge, as it is written in the regulation, I think a doctor should also know that what step the council, the respective state council, and the if the complaint is being lodged in NCH, in the Board of Ethics and Registration for Homeopathy, that is in short we tell it BERH. So then what steps we take? So I'm reading number 1, where a practitioner of homeopathy commits any act of professional or ethical misconduct, the State Medical Council or Board of Ethics and Registration for Homeopathy shall take action suo motu, very important, or on receipt of the written complaint as per the form given at the Appendix 4 with relevant supporting documents and identity proof within a period of 6 months from the date of filing complaint. Just you go through the Appendix 4, it is given in NCH. You can, this is the last page. It is the page number 20. So you can refer to this, that how the patient party lodge complaint against a doctor. These pro forma, in this pro forma they lodge the complaint. They give written complaint against a doctor in our council or to NCH. Then after receiving the complaint, the State Medical Council or Board of Ethics and Registration for Homeopathy shall examine the matter and after making inquiry shall decide the matter within the period of 3 months from the date of filing such complaints. We are getting number of complaints in this pro forma nowadays. Provided that before deciding the complaint, the State Medical Council or Board of Ethics and Registration for Homeopathy shall give an opportunity of being heard to the practitioner of homeopathy. Before giving punishment or before deciding for any complaint, it is our duty that respective state council where the complaint has been lodged or to NCH. If the complaint is being lodged in NCH, the NCH will call the doctor, they will hear the doctor, the respective state council also, we hear the doctor, and this is a legal process. Whenever a complaint is lodged, we give a time for hearing for that we call that practitioner and we hear in details what has happened, because we should hear both sides. Okay. Next, if After inquiry, the State Medical Council or Board of Ethics and Registration for Homeopathy found the practitioner of homeopathy guilty for professional or ethical misconduct, it shall take action against such practitioner of homeopathy in accordance with the provision of Act or the respective State Act, as the case may be. This is clear. I think it doesn't need any explanation. Now, this is a very important thing. Who is a legal expert for homeopathy? We the doctors. We are the registered practitioner of homeopathy. We are the expert in homeopathy. Yes, for the court, we are the expert. Court may summon you for this type of various type of cases. So you are the legal expert. You all know. We have read in the forensic. No, I'm reading the lines. No person other than a person who is enrolled in the state register or the national register, as the case may be, shall be entitled to give evidence at any inquest or in any court of law as an expert under Section 45 of Indian Evidence Act 1872 on any matter. This line, last line, is very important. On any matter relating to homeopathy. So we are expert. We are the legal expert in the matter of homeopathy. Okay. Now let us go to the next slide. Punishment. This is a very important thing. very sad thing, which Dr. Chandan Das was also speaking, that there the what punishment we get. Any person who acts in contravention of the provision of Section 34 of NCH Act 2020 shall be punished with imprisonment for a term which may extend to 1 year, or with fine which may extend to 5 lakh rupees, or with both. Achha, here someone may ask that what is written in the Section 34. Let us see what is written in the Section 34. Section 34 clearly defines the rights of person to practice, what a homeopathy practitioner should do. But if he does it in the wrong way, then he is liable for punishment. Okay, so a practitioner of homeopathy will be allowed to practice homeopathy as a qualified practitioner. He or she holds office as a physician or surgeon or any other office by whatever name called, which is meant to be held by a physician or surgeon, as the case may be. He is entitled to sign or authenticate a medical or fitness certificate, as we have already discussed, or any other certificate required by law to be signed or authenticated by a duly qualified medical practitioner. Yes, and number 4 was already we have discussed, he is a legal expert in the matter related to homeopathy. So if he doesn't follow the act which is given in the Section 34 of NCH Act 2020, then he is liable for punishment. Okay, and the punishment is given clearly. I've read it. Next slide. Now, probably this is my last slide. Adjunct registration. This is given in the not in the regulation already discussed, but it is given in another regulation which you will get in the in our NCH website. The link has been provided there. This regulation is the National Commission for Homeopathy Manner of Preparation and Maintenance of National Register for Practitioner of Homeopathy Regulation 2022. It is also been published, has been published in the year 2022, in the 13th December 2022. Why I have chosen this topic here? Because this is also have a legal bindings. Doctors should know what is the meaning of adjunct registration. most of the time, most of the physician, even myself also, when I was not in the council, I was also having this knowledge. You will laugh about that. That a person having CCH certificate or NCH registration, we are dealing with NCH, so he can practice anywhere in India. This is a usual saying in most of the doctors, but NCH has clarified it in the regulation 8 of this regulation, which I have mentioned just now. So, regarding the practice or employment in other state, suppose I am a registered doctor of West Bengal, and in the summer season I want to practice in Jammu Kashmir, okay, and in the winter season I will practice in Andaman and Nicobar Islands, okay. So as my wish, yes, NCH is also providing us the proper guideline how to do that. Suppose you want to study your MD in any other state outside West Bengal for job purpose. You want to go, you are in job in, suppose you are in job in Delhi. For that reason, NCH has clearly mentioned practice or employment in other state. I'm reading the lines. A licensed practitioner of homeopathy who wants to practice in any other state or union territory shall apply to the concerned state medical council for homeopathy in the form 5. This form 5, you can avail it from any state medical council. The state medical council have this pro forma of form 5, they are having that. And on verification of the particulars, the state medical council for homeopathy shall enroll them in form 6. They will issue a certificate in the pro forma given in the form 6. So what you will do, suppose I am a registered practitioner of West Bengal, I have got the registration of West Bengal, and I want to practice in Jammu Kashmir. I will go to the state medical council for homeopathy of Jammu Kashmir. I will fill up the form 5 there. I will attach the certificates which are required. Mostly the required certificates are the Aadhaar card, your West Bengal registration certificate, and the area of practice, your address of practice where you want to practice in Jammu Kashmir. You have to give the proper details of that practicing area. So they will verify it. It will take 1 month or 2 months. Okay. After the verification will come, they will issue a certificate in form 6. And in case of union territories or where the state medical council is not been set up or yet to be constituted, there the practitioner should directly apply to the Board of Ethics and Registration for Homeopathy of NCH. Suppose I was telling that I want to practice in winter season in Andaman and Nicobar Islands, but in Andaman and Nicobar Islands there is no yet they have not constituted your state medical council. For that reason, you have to apply to NCH, BRH, that is Board of Ethics and Registration for Homeopathy. You will contact their office. They will give you the form, that is a form 5, and they will ask you to submit the documents, and then after verification they will issue you the certificate, and they will give permission from, or as in West Bengal we are giving permission for 3 years. Suppose the students who are coming for studying MD in NIH or in our state government colleges, so they are dealing with the patient of West Bengal, our state. So law of the land will apply for them here, na? So they are coming with the registration of other states, and they are working here. They are working in the indoor and outdoor, and sometimes they may land up in medical legal problems. So then our council is well aware that this student is being registered here. He or she has taken the adjunct registration, and it is we know that, and in case of any medical legal problem, we can safely support that doctor. Okay. Suppose in our state there are many practitioners who are coming from other state. They are working here. They are doing job here in various medical colleges, but they are having the registration of Orissa, they are having the registration of Tripura, any other state, but they are working here. The law of the land will work here, na? So here we should be very alert. You should take our adjunct registration. NCH is clearly telling in the Regulation 8 that the adjunct registration is the only procedure you can save the doctors from various type of medical legal problems. So I have uttered this, means I have discussed this topic here because it is very, very important. Next. Thank you very much. And good night. Any questions? I would ask the viewers if somebody wants to speak anything or wants to ask anything.
Uh, Thank you so much, Dr. Mithun. And yes, there are a few questions. And first of all, I would really like to thank you for briefing us about all these aspects, legal aspects, which we should take care of. And the questions are also very, very genuine, I feel. When you talked about the record keeping, okay, that the prescriptions are to be kept, the record of prescriptions are to be kept with for each and every case. So Dr. Arijit Pal Chaudhary, he is asking, is it practically possible to keep records of all the participants, all the prescriptions? We can maintain a register to keep records of medicine prescribed. Please explain.
Dr. Arijit Dada, actually the main thing is that for 3 years, they have mentioned that for 3 years you should keep. NCH has clearly mentioned, because I understand that it is not possible for a person to keep all the records. Usually we all don't keep any records. So we give the prescription to the patient, and they also maximum time their prescriptions are lost. So it is not a practical thing, but for the safety, because nowadays complaints are very frequently, we are receiving complaints. Means I even asked previous registers, I talk with the previous registers that whether you receive this type of complaints in your time, they tell that no. So gradually the days are coming worse, because we should be alert, because in the news channels you are all alert regarding that throughout the India what is happening. So for your safety it is better, but in NCH it is written only for 3 years. Only you should keep at least for 3 years. So I have underlined that line. Try to keep it for 3 years, but if you want to keep, it is better. This is the only advice I can give.
I would like to come in with this. Actually, apart from the legal aspect, even people who are going for medical insurance and all, I've seen
Yes.
one of the cases wherein the insurance people, they go back to the physician who has prescribed the medicine, and they want to look into the actual prescriptions. So one of the allopathic doctors I came across, so that was one case wherein he was also maintaining just a register. He was having a attendant, or you can say a person at the reception. He had one person at the reception, wherein the patient whosoever used to come, so he used to maintain that register. So record keeping, of course, it is very, very essential, whether it is a legal aspect or it is related with the insurance or anything. So subsequently this kind of a record is required. So what Dr. Arijit has said, ki whether they can maintain a register, of course, because we are supposed to give the prescriptions to the patient, and we cannot store everything like that. But of course, keeping a register wherein you mention the name and the age, gender, and also the address, because the names can also be similar, and then a column wherein the diagnosis or provisional diagnosis and the prescription part can be maintained, and along with the date. So that ways, I think that minimum this thing should be maintained to escape from any legalities and punishments like that.
Yes, yes.
So Dr. Mithun, coming next, Dr. Somit Hajra, he is saying, with reference to attending emergencies or medical examination, is there a template of a consent form available through the council website or NCH?
No, there is no specific consent form. I have not seen. Consent form is usually you can go through the forensic books because in there is no specific the format which is available in most of the hospitals. That is okay. The NCH has not given any special consent form, but like the medical certificates and fitness certificate, they have shown the example, but the consent form I have not seen. So in normal way we use in the hospitals, that is that you can use, because nothing different. I think NCH will not have another opinion regarding this. I think same opinion will be there. Okay.
Regarding this attending emergencies or medical examination or things like that. So, what I believe and what I have also seen is, like, when you are examining a female, definitely there should be a female attendant along with you. And as far as consent is concerned, uh, it's more of a verbal consent in the hospitals. And if as a practitioner or a private practitioner, I think if you can have a pamphlet kind of a thing, or when you have your prescription pad over there, or when the patient is coming to your clinic and you have a attendant who can get the form filled, wherein you can mention that I voluntarily have visited this clinic and I'm okay with the examination part, and also that can be conveyed, and also in a written form in the private practice that can be kept. But again, coming to the record keeping, yes, again it will be a additional aspect which I think which will fetch a lot in the days to come with respect to, again, the legalities. Then
One thing,
another
one
very,
thing,
very sorry, yeah,
okay.
come.
One thing I have already mentioned, that for normal consultations and for indoor patients and for normal diagnostic procedure, we don't need any consent form. For emergency cases, the consent forms are available in the hospital, and the old consent forms which we have seen in our hospitals, that is enough. Means, we don't need any extra thing in the consent form. So
No, that's fine, Dr. Mithun. As far as the hospitals are concerned, you are safe because there are certain clinical establishment rules and everything is there. And the patients are coming over there, and over there also, before we want to examine a patient, we do ask them, like, we need to examine, and we need to, so you are okay, you are comfortable, like that. A verbal consent is there. But when we are coming to the private practitioner, when you are having your own clinic and all, so I believe that the form, a simple form to fill the demographic details of a patient who is visiting your clinic, and over there only a line mentioning that you will be examined as per requirement or something, and where you agree to this, and you can get it signed and keep it. So that way is what I feel should be a beneficial thing. Another very, very important topic which you have touched about is the telemedicine. So Dr. Sumit is a call or a video record of the medical case. WhatsApp call or video sometimes can't be recorded, or if it is it valid legally?
No, telemedicine is not is not at all mandatory. If you want to attend the patient, you can ask. You can tell the patient that you come to my chamber or you come to my OPD. It is not actually in COVID situation. Telemedicine was trained. So for that reason. The telemedicine is being encouraged. Many people who cannot come in our OPD, they are not. They are staying very far. So that completely you cannot give the complete treatment there, but you can help the patient through telemedicine at least for few days, and then you can call the patient to your OPD or your chamber. So I agree with Dr. Shumit Hajra that it is not possible always to give the video records or in every case. Huh? So yes, it is legal, and telemedicine, you can do telemedicine. State government and central government are encouraging this telemedicine procedure after COVID situation, and you can also have these facilities. But don't. Sometimes it happens that the patient uses the. I've seen just few months before I heard a case that the patient has used the WhatsApp message of the doctor, and they went to the court and they complained against that doctor. So after that, the court told that no, doctor has helped you through telemedicine. It was in favor of the doctor. So at least you should write in, not in detail, in short, and you tell the patient constantly that you come afterwards when you get relief, at least for a little relief you get from telemedicine, and then you visit my chamber or you come to my OPD. I will have a full case taking and I will give you detailed treatment. Don't give detailed treatment in telemedicine, and it is not possible also. It is not practical also. Okay.
So you mean like apart from having a video call or a discussion over phone, telephonic call or something, it is better to write a short message also, so that is also a kind of, we are coming again and again back to the record keeping aspect, which means a lot. Yeah, it's very important, and which means a lot for a doctor as well as for the patient. Because if we are mentioning that, okay, you take 2 doses of so and so medicine, and we are telling over phone that it is just for a day, but the patient, out of his own perception and all, they may continue taking the same medicine. So if you have mentioned a small message like this, so that will be a safeguard for the physician himself or herself, right?
Absolutely. Yes.
Okay. I think you have lots of questions today, and because it was very, very important topic which needed to be discussed. Dr. Abdul Motin Mullah, he is saying that for registering with another state, cancellation of previous registration is mandatory or not?
Achha, what is the question?
For registering in another state, like for in the state council, medical council, so whether cancellation of the previous registration, supposing I have registered in Delhi and I am wanting to practice, say what you said in Port Blair, so Andaman and Nicobar, so do I need to cancel my registration of Delhi and then only apply for it, or how is it?
This is a very, very good question Matinda has placed. One thing I want to clear, the last slide I mentioned regarding adjunct registration, it is not related to adjunct registration. This question is somewhat different, that whenever you are going to other state, suppose I am having registration of this state, okay, and I want to take registration, I am totally shifting to Tripura, and I want to take the registration of Tripura. First of all, I will cancel the registration of West Bengal. I will take the NOC letter, and with that NOC letter, I will apply to Tripura Council, State Homoeopathy Council, and for the registration. Okay, first of all, you have to cancel the registration of West Bengal. Then you will apply with that NOC to Tripura Council that I have cancelled the registration of West Bengal. Now I want to take the permanent registration of Tripura. Then the Tripura Council will proceed further for giving the registration after the verification process is complete. But in adjunct registration, what I told in my last slide, there no need for the cancellation of your registration of West Bengal. Suppose I want to practice in Jammu Kashmir, what I told, or I want to practice in Andaman Nicobar, my registration will be of West Bengal only. No need to cancel the registration of West Bengal. You can take registration, adjunct registration from any state. Okay. Suppose you want to practice in Uttar Pradesh, you can go to the Uttar Pradesh Council. You will tell that for education purpose, or for job purpose, or for normal practice purpose. You have shifted there for few years. You want to practice in Uttar Pradesh. You will take the adjunct registration from Uttar Pradesh without cancelling the registration of West Bengal.
Okay.
Okay.
So that means, like, if you are shifting altogether, you are going to settle down at some other place, then the cancellation of the previous state council, that needs to be done. And if you are just moving for a few years for some purpose, so that ways you can have a adjunct one, right?
Yes, yes. And NCH is taking the drive through your Aadhaar card. What is the process of digitalization? We are going through the process of digitalization through Aadhaar system. Okay, throughout the India, all the fraternity, means National
Yes.
Health Agency, is putting all the healthcare facilities like dental, then nursing, pharmacist, Ayurveda, Unani, Siddha, all homeopathy in the digital platform, and we can understand. We will be able to understand through Aadhaar system. Aadhaar system, we can identify that where this doctor is doing practice, where his registration is there, in with he is attached with which council. This will be all clear within few years, and this is a very good drive being taken by National Commission for Homeopathy.
Right. I think there is slight disturbance in the net. Anyways, coming back again to one question which has been asked by two different people. This is about are drug license required for homeopathic doctors? Please clarify if a drug license is needed for dispensing of medicines by a homeopathic doctor.
No. Drug license, yes, drug license is you should go to the drug control office. They will give the detailed. Actually, council is not related to this type of. We don't have the ideas of this type of questions, because actually there is a separate body who are dealing with this type of rules and regulation. They will speak you the better, but drug license is required for homeopathy doctors also, because for opening a shop, he needs drug license and trade license, and there they will have the inquiry that what are the education qualification of that. In West Bengal, I know that minimum bachelor degree is required, and a space is a measurement of the space in height and length is required, in square feet is required for opening a chamber and opening a shop, and chamber and shop cannot be in the same premises. These are the rules and regulation, and the expertise person are the drug control office. They are the separate units, so they are expertise regarding that. Our council don't deal with this type of activities, and we don't know exactly.
Yeah, there was a issue. If I remember, there was a lot of discussion in the NIH Alumni Association WhatsApp group also about this. That the homeopathic doctors should not be like they are not supposed to keep the homeopathic medicines with them for dispensing. Rather, it should be that only they are supposed to give the prescription. So I believe we need to look into this further. As you said that the NCH does not have any such guidelines, and the drug controller, that body needs to, like, now from where we can get more information. But
No, Didi, I want to speak that in one of my slide, I have uttered that a registered doctor, registered practitioner of homeopathy is entitled. NCH is clearly telling that a doctor can prepare his own medicine and he can dispense his own medicine. It has been told in my slide, one of my slides. So NCH is giving clear idea that this confusion has raised many times in many WhatsApp group. I have also seen that whether a doctor can prepare the medicine or not, or a doctor can dispense the medicine. Yes, we can. There is no legal issue regarding this. Okay, and if you want to regarding a shop, there are issues are different. But in your own chamber, you can prepare, you can dispense your own medicine. What Hahnemann has told many years before. So there is no objection in regarding this. I think so.
Okay. Then Dr. Rezul Moin, he has asked, registration should not be mandatory during the time of interview exam for PCS or NRHM. Registration mandatory after joining within 6 months. That's what he is wanting to
Actually, this is a frequent question we are facing in our council, that recently we are having job in National Ayush Mission. In various districts, recruitments are going on and the verification process are being done, and we are also involved because the verification is being done by us only. Yes, it is true that when you are going through that examinations, only those examinations where there is written clearly in the instruction or in the leaflets or in the advertisement, it is clearly mentioned that during the interview you don't need the registration, but within 6 months of joining you should give the registration. Otherwise they will not process your examination. Yes, it has been mentioned in the advertisement also, but it is not in every cases, not in the Public Service Commission and not in the cases of Health Recruitment Board. That we are having the recruitment of 2 years before we had the recruitment of medical officer. No, in the Public Service Commission, in the recruitment for medical officers, yes, it is very, very mandatory that you should, in their advertisement, I have repeatedly seen that the registration is must. But recently we are having the advertisement in various districts regarding the various projects which are coming from central to state. There it has been mentioned, even in Panchayat also, many Panchayat authorities have given the advertisement. They have told that yes, we will select you, but after 6 months you should have the registration. You can show your provisional registration certificate during your interview, but after that you have to submit. It is mandatory, you have to submit otherwise your candidature will be cancelled.
Okay. Then one more question, which also came to my mind. If a doctor is here, is having PR of a state and also having NCH registration, and the doctor wants to practice in different state, do the doctor require to get registration of the current state of practice?
Didi, please repeat. It is not clear. Which question?
Okay. This is a question wherein, like, if a doctor is having registration of a particular state, okay, and is also having NCH registration, okay, and the doctor wants to practice in a different state, so does the doctor require to get registration of the current state of practice?
Didi, actually, what is the meaning of PR? What is the meaning of PR? It is provisional registration.
Registration, yes.
Provisional registration.
I think so.
No.
Yes.
With provisional registration, if a doctor is having provisional registration of a state and also having NCH registration, no. Provisional registration is a registration which is being issued to a intern for the beginning of internship. It is being provided, and it is for the hospital use only where he is doing internship. Outside hospital, provisional registration is not at all legal. The question is, I think the question has been raised.
It is permanent. Okay, it is permanent registration, not provisional registration. Okay, supposing like I have West Bengal Council ka registration with me, and I also have a CCH, which was NCH previously, CCH registration. So if I want to practice in UP now, so do I need to have the registration for UP separately as well? That's what I believe the question is.
Yes, I could understand. You have to take the adjunct registration from UP. You are the registered doctor of West Bengal. Okay, you want to practice in UP. Yes, you will go to UP State Medical Council for homeopathy, and you will put up the form. We fill up the form of the adjunct registration, and you can apply for the adjunct registration for the duration you want to stay in or you want to practice in UP. And if you want to permanently shift in UP, then you will cancel the registration of West Bengal, and you will get the registration from that Uttar Pradesh. Okay, mainly the NCH is telling that please see whether the person is having the Aadhaar and the voter card, okay, because of that state only. This is one of the issues we are facing. We are not able to make the doctors understand, because previously it has been a trend that many doctors from other states used to come to in West Bengal or in many other states also. So the main issues because we are approving whenever a person is filling the National Commission that NRH existing practitioner form, the first thing we are seeing that whether he is the resident of this area or not, and then we are issuing, we are allowing that case, and we are sending that case to NCH. Because the matter of adjunct registration is there, you can cancel the registration, you can take the registration of that particular state where you are permanent resident. Because recently we had an order from NCH, because some of the students are facing problem regarding the MD students. They some of the councils are forcing them that you have to take the registration here for at least for 3 years. You have to take the permanent registration here. Okay, this is very illegal. You cannot do so. So the NCH has clearly made it clear that you should not pressurize those persons who are coming for job purpose or for education purpose or for practice for few years. You can have the adjunct registration. Why you are pressurizing that those candidates? Previously, when we used to do MD in our state government hospitals, the persons who used to come from other states, my friends are there who are coming from other states, they have to take the registration, permanent registration of the state. But after the concept of adjunct registration, it is very clear. If you want to practice in UP or if you want to practice in Kerala, you go to Kerala state and you tell that I am having the permanent registration number of West Bengal and I want to practice, or I want for the education purpose, I want to stay here for 3 years. They will give you adjunct registration. So there is no problem. It is very, very easy. Previously, we have the concept that CCH, with the CCH form, with the CCH certificate or NCH certificate, we can practice anywhere. No, there may arise legal issues also. For the reason,
Okay.
NCH has cleared the matter.
Okay, okay. So that means under the national registration, national register, so we have all the medical councils, homeopathic medical councils of various states all together, and the particular person registered over there is they can have an adjunct, or they can cancel for, like, supposing for West Bengal, I'll cancel and I can have my registration in Delhi board.
Yeah.
Like that,
Yes.
right? Okay, so even having a CCH permanent registration or like that, so that will not mean anything if I need to practice
Yes.
in any particular state. Okay, and what point you raised about was about the about getting the job. So we have seen many times that UPPSC, that Uttar Pradesh PSC, they are saying that they are asking for that person should have a registration in UP, then only they will like that person can apply for that examination of UPPSC. So again, so many people they, like, the candidates, they shift over and then they cancel their, or they take an additional registration, like that they get it done. So does that mean only about practicing over there and not having a Aadhaar card or a voter ID for that particular state? They are not residents of that or having a domicile like that.
Yes, well, yes, we are also facing this type of problem. So, Didi, I want to clear it very, very clearly. NCH is very clear regarding that. Some of the council is not listening. I should not say like that, but some of the council are not listening. Just few months before, I faced a same problem in Rajasthan. Some job was there 1 year before. So students from NIH, they came to me and told that we have to go to immediately. We have to go to Rajasthan for the exam. So I have to cancel the registration of West Bengal. We will take the registration from there. Okay, then I told that please go for adjunct registration. NCH is providing the adjunct registration. You have a talk with that council. So most of the council, they are not taking it very seriously, but it should be taken very seriously, because NCH and CCH also in the last, when it was in the under the board of governors, it has been mentioned. I have the orders. Even Dr. Kumar Vivekananda Da also, he knows it very well, that they have issued the order that for job purpose, education purpose, and for practice purpose, you can have this adjunct registration. This will clarify all the problems, but most of the council, or they have the local issues, they have the local governing bodies, or they have decided that no, we will not take the matter of adjunct registration. We will not allow those candidates who are coming from outside state with having adjunct registration here. We will not allow. They will allow only those candidates who are having permanent registration. This is up to the that council, because councils have their own governing bodies, and even they are consulting with their own state governments of that particular state, and that state do not want this type of adjunct registration provision. But those states who are willing to enter into the adjunct registration provision, it is I think it is my personal opinion, it is a good it is regulation, and it is good initiation from the NCH to stop all these type of problems which the students are facing for getting job. Even MD
Okay. So, Dr. Abdul is saying that means a doctor can practice in no doctor can practice in more than one state permanently, as only one permanent state registration is possible, right? So, similar like what Dr. Abdul Motin is asking. See, I have a state registration of West Bengal, and I have CCH registration also, and I was posted in Noida center. So over there in the hospital, now this Noida is in UP, but I don't
Yes.
have UP registration. But as because I have been posted there, so
Yes.
I have I need to have an adjunct registration also for UP. Okay.
Yes, you should go to the UP council and you will take adjunct registration, because the law of the land of UP will be applicable there. Because you are having the registration of West Bengal and you are working in the UP, the patient you are day to day you are visiting the patients, or the patient who are in the indoors, and you are giving regularly the medicines for that. Any problem, any medical legal problem, that UP council should know that a doctor, such and such doctor, is under our council also, who is having the registration of West Bengal council, and this record is also sent to NCH also. One copy is also sent to NCH for reference also. Okay.
Okay. So can we have two adjunct registrations also for two
Yes.
different states, or at a time only one we can
Yes,
have?
you can have two adjunct registration also. Suppose you want to practice there, and after that you got MD in another state. So you have to take the adjunct registration. You cannot always cancel your original registration. Permanent registration will stay in your state only. You are residing. Okay. And then you can take adjunct registration, because you are getting MD in another state. You will take adjunct registration. Okay.
Okay, right. I think it has been a very, very elaborate session altogether. And I'm really, really thankful to Kalyani sir, Bidyut, and to bring up this very, very important topic for discussion. And Dr. Mithun, though he's like junior to me, but being a registrar, having so much of exposure, knowledge, and he has shared that. Dr. Chandan Das, in the very beginning, in his introductory part, he also brought out certain points which I think we as physicians, we don't know, or maybe we are ignorant and we ignore also. So all these aspects have been taken care. I'll request that the national register aspect, that one separate CME should be taken up, and I'll request Dr. Mithun to have a stepwise like a presentation that how this is to be done, so that we all can renew and we can do the needful for the upgradation of the education also. All those aspects can be taken up. So thank you so much. Over to you, Bidyut.
Good evening and welcome back, all our moderator, speaker, inaugurator, our beloved President Kalyani sir. Just this topic came all on a sudden, because there are certain issues which had been going on in and around the state and across the country. And a few years back, I had a discussion with Dr. Chandan, relating to the medical legal aspects while he was the then ACP of Cooch Behar before COVID. So we all need to be well versed with what doctors should know. This has been an exhaustive session, but we need more and more explanations on this. I'll request first our beloved Dr. Kalyani sir to share your views, and also if we have our beloved Dr. Pralay Sharma, if he's there, please bring him on screen. Over to you, Kalyani sir.
Thank you, Bidyut. Fantastic CME. And asset of the CME is among the 104. Every one of us is not only encouraged but highlighted where next by knowledge, many of the things were not very much clear. I don't want to extend more to make you bore because very details, very fantastic informative CME today. Really fantastic inauguration by our inaugurator, being from the Home Department. Fantastic. Beautiful presentation by Mithun Chakraborty. Pritha is one of our torchbearer of CME, giving maximum effort. Thank you, Pritha. And what I want to just tell you a few words which we learned from our teachers. In the year of 1976, in jurisprudence classes, one ENT specialist, Dr. S.R. Chatterjee, those who are from Collector Homeopathy Medical College, they know him. He was from modern science, allopathy doctor, eye specialist. He took the responsibility to teach us about legal aspect of this, medical legal aspect, and he used to take our classes. And in classes, he told me few cases that see, these are the harassments you have to face if you do not know. Remember, you are class 1 citizen of the country, you are doctors. Nowhere ignorance will be excused by anywhere. Court will not excuse by your ignorance. So you have to know the things for your own safety. Nowadays, safety first is a very common word. But during those times, devotion and service to the others were the most important words. Regarding personal safety was not that much encouraged during those days. But he used to tell that as a class 1 citizen, as you are supposed to help others, you must save yourself first, especially from legal side, from social side, from criminals, from irregular people, those who are disturbing the society, and many people, those who are usually live by crimes, they try to find out such doctors who are less knowledgeable, ignorant about their legal aspects. They will go to you, they will come to you, they will ask you certificates, starting from the death to accident to this and that. And after a few months, you get one notice from the court, you are called by the court. And there, after facing few sessions, few sittings, you may be called as conspiracy of murder or indulging crimes. By knowing these things, we understood how much serious things this legal aspect is for medical practice. With the day's advancement, we have seen these varieties of crimes are approaching. It has become a fantastic profession nowadays, cheap profession. So we have to be more alert to prevent ourselves in every respect. Number one. Number two, we have a great responsibility. We homeopaths should come at par with the modern system of medicine, or we should not have any lacuna regarding any aspect. Not only should gather knowledges, not only we should give suggestions to human beings suffering, but also know the legal aspects to keep our system uprighted, to keep ourselves alert, to give proper service, to prevent crimes in the society, to prevent indulgence or rather misuse of homeopathic system, misuse of homeopathic doctors by collecting certificates, etc. So this is very, very important chapter. I think all of you must agree that we need few consecutive CMEs regarding this aspect to put all these things inside our mind, indented that we should not never forget these things to prevent harassments. That's why, as we have heard today, few cases, we can bring some cases as example how harassment doctors can face in court in due of time if they do not follow the rules and regulations of the NCH. So anyway, brothers and sisters, we must be very alert and we should go on following to the NCH laws, rules has been mentioned for our benefits, for upliftment of the homeopathy, and to be confident that we'll never be trapped under any crime or any irregular peoples. Thank you very much to all of us. Fantastic CME. And we expect that Dr. Chandan Das, he will come one day by his experiences regarding the judicial crimes. We'll be encouraged to learn many things. Please. Okay, thank you very much. Very nice CME. Bidyut, please.
Right, sir. Agreeing with you, I'll request Dr. Chandan to be a speaker. ASAP, though he is having a busy schedule as a DSP of Cooch Behar district, which has been under a lot of pressure all through relating to the law and order. But Dr. Chandan, thank you so much, and we are eagerly waiting, as we had discussed 3-4 years ago, to have a session. Chandan got disconnected. He is now on patrolling duty in some part of the city of Cooch Behar. I think he will be joining soon. He had WhatsApp me. So we are eagerly waiting to learn from and listen from Chandan, as well as I like to thank Pritha and her inputs. And Pritha, please suggest that we should have more and more such CME, as sir had said, that we to enrich us with the protective shield, like the antivirus shield from Alumni Association, relating to be a good law-abiding citizen, be a proper homeopath as per the law. Because while traveling across India, I had found people are prescribing a lot of modern medicines, and that also very confidently. In various certain states of Maharashtra and others, where some modern medicine had been officially allowed to prescribe. And
Yes.
one consult. Yes, Pritha?
Yeah, even rather, what I know, there are certain universities who are conducting the pharmacology courses for a year or something, and with that certificate course, they are allowed to prescribe the allopathic medicines as well as emergency medicines. There are a lot of things which are coming up, like the bridge course, and all those aspects have been discussed, and a lot of gadget notifications have come up. So what happens, like we ignore certain things, and we feel okay, kuch hoga, chalega, chalta hai. So this chalta hai attitude we have to get away with, and we need to be very, very focused, conscious. See, when we ask, like, we as citizens of India, as doctors, we should be given respect and this and that. So we have a lot of responsibilities also towards our fellow people, fellow human beings, and also towards the society in that respect. So I believe that being doctors, and we should have such CMEs wherein people like Dr. Chandan Das, people like Mithun. So all those people, those who are involved, those who are there in the system, and they day to day they come across such issues and legalities and things like that. So they should come up and should you when you explain with the case, you understand more and you remember. So how we used to study when we used to read Materia Medica, and how our professors used to explain with a particular case or something, we remember it more better. So I'll request Bidyut that another CME related to National Register for the updating of registration with respect to each one of us who are there. That should be taken up next. And with Dr. Chandan Das, again, the related aspects can be taken up. So thank you so much.
Right, right. I have got the message, Dr. Pritha, and we will be definitely going through it. We'll be requesting you to suggest the speaker and who can be the best speaker apart from you and few of your NCH colleagues now, those who are directly involved in this rules and regulation process. So please
No.
organize on that. We can have
Hmm.
it on the first CME of 2025. That's on 12th of January. That can be a very good
I think,
date.
no, Dada, seriously, I feel because this updation of the National Register is going on for quite some time, and there
Mhm.
were certain hitches in between. So I feel the next CME, Dr. Mithun can again come up with a short presentation with respect to this National Register updation for each practitioner. So with that, see, we have registered with West Bengal Medical Council, but how I have like the what he said as adjunct and all those things. So if we can make a presentation, each one of us can take down those steps and we can do it for our updation.
Sure,
So I
sure.
think the next CME also, Dr. Mithun, please, you agree to this?
अच्छा देख रहे हैं अच्छा ठीक है I will talk to Bidyut and you also at least another speaker should be there from another side
Yeah,
also
Okay.
we have a
Uh,
speaker. We have a
From
speaker on the 24th November CME, Dr. Shahatisri Ghosh, some rare
Okay.
medicine about sciatica. That can be one. But for Mithun, the important topic, what Dr. Pritha had mentioned, the means upgradation in the NCH register, it's very, very utmost important now. So we'll incorporate that. We'll request Dr. Mithun with the permission of our President Kalyani sir, so that we can have that session. And
on
that
Sure,
on
definitely,
which
definitely.
next date
My suggestion,
Papa,
give him a
kindly tell
little bit time. He's very busy. Which is highly busy. Give him time. He will come, I think.
no I am unable to hear at least
But I'm
tell
telling
me
that
the
you are highly
huh?
busy. You think for a few days when you can come with this thing what people are telling. Okay, it is difficult for him to give him immediately concept. What I think.
Okay.
no, sir, we can
Otherwise,
pressurize him.
okay, okay.
he's a beloved brother. And also, Dr. Chandan, please take your time, but we want you in the first CME of 2025, that is 12th of January. If there is no Rashmala pressure, Rashmala
Positively,
pressure,
positively. No issue. No issue.
Now he will tell us the time.
so
Chandra will
so
tell us
we'll
the
be
time.
having you as a speaker on 12th of January,
Yeah, yeah, yeah.
because you being in the police service and all over India, the homeopaths, you being a homeopath on board and from the core of heart, I saw you as a true homeopath, what you had done through during the COVID days when I was visiting the North Bengal. So hats
Yeah.
off. And Dr. Chandan is a core homeopath till he being a DSP of West Bengal Police. But Dr. Chandan will be able to guide us how a physician on the practitioner ground can be saved from harassment by the legal authorities. The
Yeah.
topic is to be, the headline is to be decided by Dr. Chandan himself. I'm just thinking on the aspect what we had discussed 3 years back. So we are putting up, requesting Dr. Chandan to be there as a speaker on 12th of January on 2025. And with that, we like to thank everybody on board here. And
I
also
want
Dr.
to,
Pralay Sharma, who, in spite of his busy schedule as a the deputy super of NIH hospital and all the activities, he had been here for few minutes, few time he had been here, but he was not. Also, is Dr. Pralay Sharma is present in the studio?
Vidhu, may I tell a few things? 2-3 minutes, please. Vidhu.
Yes, sir. Yes, sir. Please, please, sir. Please.
Dr. Chandan, that's what I like to, I cannot extend myself to tell the facts. Our teacher, one was Dr. J. Bose from Arjikar Medical College, and one was eye specialist Dr. Isar Chatterjee. They used to come in our classes as jurisprudence and law at that time, the subject was this. They will first tell a story for 15-20 minutes, and whole class, usually their classes are in the late hour from 3 onwards. So everyone is off or disturbed. They will start first one story, facts. These judicial crimes, legal cases. Then after completion of the story, the facts, whole class remained completely silent in late hours, completely silent. Then they will start the subject itself. So jurisprudence and law and the legal suspect is so interested. If Dr. Chandan takes the strain to collect the cases present with the presentation, that will be best. As that we have experienced in our classes, it was so interesting. We cannot remember those cases, and being inspired by the cases heard from our teachers, we became alert that this should not be done. Anyway, wherever you are having some cases known, we can present in this CME. That will mostly encourage us. Thank you.
Sir, I will try my level best, sir.
Sure, definitely. You can do it. If
Sir.
possible, you can correct numbers. There are many cases, case diaries.
Thank you, sir.
Sir, I will try my level best, sir, on 12th January.
Okay, whatever maybe 3-4 cases is enough.
Sir.
And thank you, everybody. Please be there in the backstage. I'll request Dr. Orko Mukherjee to conclude the session with your technical inputs on the certificate of the CME. Dr. Orko Mukherjee.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to like it, share it, subscribe it, and don't forget to hit the hit the share button to share it with every other else. So one more thing about this e-participation certificate. I hope many are facing issues regarding that they are not receiving the certificate after filling up the form. Let me just warn every one of them that there may be some issues while filling up the Gmail. Just go through the Gmail once or twice before entering the other things, because if the Gmail is wrong in somehow position, for example, if you have entered gmail.com but it has written gmailb.com, then it will not show up to your mail account. You have to just check the mail account, mail address once and twice or more than that, if possible, to be just particularly sure. So this was one information, and other one is that after the CM, after this live stream ends, the form will turn off after few minutes. Means after 15 minutes of the CME ends. And one more thing, do make sure to join our WhatsApp channel. The link is in the description given below. Over there, we just keep the updates. Means we just give the updates about our next CME, so that before scheduling it, you get the info, and from there on, you can just go to the link, click on the link, and then come to the YouTube or Facebook, whichever is possible to you. And those who ever are still from this Instagram part, I know many were cut off short from Instagram part. Let me just explain you that. So basically, what happens on Instagram, there are only 1 hour limitation for this live stream on Instagram. So that is the reason why you have been cut off and came to this Facebook and YouTube part from whichever platform you are watching. So this was it. And we have other channels on Telegram, also in Twitter. You can just go and check on this. All the links are given in description. We have a Spotify playlist. You can go there and also check that out. So with this, thank you again. Thanks for watching from all over the world who are watching this channel from the very beginning. Thank you for being till the 104, and we hope to get your blessings and prayers for new things on our upcoming CMEs. With this is me, Orko Mukherjee, ending the